Dr McDevitt, what do you believe are the biggest challenges facing general practice in Scotland at the moment?
Well, I think there are a number of big challenges, and probably the one which most GPs would talk about is actually the overburdening of them with work, the capacity to take on the additional work that's come our way in recent years. In general practice often is the best place for things to be done for patients, and we've taken on a lot in recent years. Obviously we've had things like the cough, but there's often increasing amounts of work we do for patients by investigating them before hospital, etc., and managing complex conditions and doing prevention afterwards. So it's about capacity, the clinical capacity to deal with what our patients need near their homes and in the community. So that's probably one of the biggest issues. But obviously in doing that, it's about doctor time, and it may mean in some areas, particularly deprived areas, that you need additional doctors in order to allow doctors to have a longer consultation time. But you can also assist capacity by providing other staff, such as alcohol workers, who can be available in a practice to deal with an alcohol problem, which may arise where you're seeing somebody with abdominal pain, but you can refer them to an alcohol counsellor. But also, one of the major issues is lack of premises. That many of our premises now really have not got the capacity to take in the additional staff, or indeed the number of doctors consulting that we're required to provide what our patients need.
How do you think SGPC has responded to these challenges that you've set out?
Well, I think we've done a lot in recent years, particularly with our Way Ahead document, which was our way of setting out these things as a priority and setting policy in Scotland. And I think it's been very successful in that a number of organisations, and probably most importantly the Scottish Government, has referred to our document and taken some of these issues on board. For example, there has now been a Scottish Government working party set up on GP premises, which is at last paying attention to some of the pressing needs that we have.
Do you think the Scottish Government is genuinely listening to GPs?
I think the answer to that is yes. I think it does. It doesn't listen enough, as we would always say, but I think as a government, the current government is listening to GPs. We have to translate that now into the impact that GPs can have, and the decisions that are made within the country, particularly in health boards and in the forthcoming new health and social care partnerships.
The Scottish Government has said that it is keen to introduce a more Scottish GP contract. Do you think this is the right way forward?
Well, we've always had elements of the contract that had to be tartanised or made appropriate for an environment, and that's somewhat inevitable when you have a number of different governments within the same country. So I think we've always done that, and it's just the proportion to which we've done it. And I think the current government wants to move to a more Scottish contract, and most of the areas in which they're beginning to look at seem appropriate for that approach. And the government's already set out a number of areas in which it would want to discuss. We're happy to discuss that. We've yet to get to the stage where we can agree on it, but we're very happy to discuss these areas.
Okay. And if you were advising GPs on how to get more involved with the BMA, how would you encourage that?
Well, in terms of general practice, for most GPs, the most obvious way in which they can get engaged is to become involved with the LMC. They can go along and just be a guest at one of the LMC meetings. Obviously they can compete in elections to be elected there. There's a whole number of committees that they can be involved in which they can start to see the agenda that's required for general practice within the health service, both locally and at a national level. And many GPs, particularly young GPs, find that the route into taking interest in medical politics and helping the decisions that are right for practices, GPs and patients.